Hello, class. Good day. I welcome you to another section of our class. This is Module 4, and in this module, we'll be looking at the topic titled Social Work for Vulnerable Populations. So, we'll be introducing ourselves to who is referred to as vulnerable individuals, vulnerable populations, and the likes. So the contents of the module, we have social care vulnerable people. Who are the vulnerable people? We'll define that, we'll justify that to some appreciable extent. And then and we'll move on to the care for each persons. Then move to care for sick persons and persons with disabilities. Then we move to care for babies and infants. So it is going to be a it is going to be a guide on how to care for these vulnerable people in the society. So let's introduce ourselves to the topic, whereby we have that social care for vulnerable people. It refers to the system of support services that is designed to help individuals who maybe due to age, disability, illness, mental health conditions, poverty, abuse, or anything like that, in one way or the other, who are unable to fully care for themselves or maintain an independent and dignified life. So, in simple terms, this is just to define it. This is social care vulnerable. Social care for vulnerable people can just be said to be the act of supporting or creating a support service. It's an act of creating support service for those people that are marginalized, the vulnerable individuals or the less privileges, which can be the level of the less privilege can be more probably poverty, can be age, can be mental abuse, can be child abuse, it could be life circumstances, it could be disability, it could be through illness, it could be age and the likes, it could be health conditions and the likes. So now these people are the proper care is the act of supporting them and providing for them properly, so that they can actually fully care for themselves and also maintain an independent and dignified life in the society. So now this broad field, it encompasses a wide range of assistance from personal care and practical help in daily living. So through emotional support and protection from harm, and also to enabling social inclusion and meaningful community participation. So vulnerable groups or vulnerable individuals typically include older adults, people living with physical or learning disabilities. That's just as we have tried to explain initially. So it could come in various forms. It could be physical or physical challenge or physical disabilities or learning disabilities. It could be individuals with chronic or terminal illness. It could be children's. It could be families in difficult circumstances. It could be people experiencing homelessness. It could be those with severe mental health challenges, and even survivors of domestic violence or domestic exploitation. It could be anybody. So far, it has to do with they happen to be vulnerable individuals or groups. So now let's move on to social care for vulnerable people. Now, social care refers to the wide range of personal, practical, and supportive services that is provided to individuals who um who due to age, illness, disability, mental health challenges, or other vulnerabilities require assistance to live as independently and comfortably as possible. So it is just as we've been explaining initially in the previous part, well, in the introductory part. So unlike medical or healthcare services that primarily focus on diagnosing and treating illness, social care, on the other hand, emphasizes everyday living needs, such as helping with washing, just the basic, to be able to do the basic, helping to do the basic things that are normal and ordinary human beings should do. So it could be washing, it could be dressing, it could be eating, It could be mobility, it could be household task and medication management, while also promoting emotional well-being, social inclusion, make them feel among socially, protection from harm, creating some kind of protection for them, and overall quality of life. So let's move on to the next subtopic, which is the care for aged persons. So this is actually how we can actually care for people that have become the elderly people, the aged person that have become very old. We have them to be mostly grandpas and grandmas, that is grandfather and grandmother. So in Nigeria, the care for aged persons, typically those aged 60 and above. That is when we talk about care for each person, it could we can easily drag it back from 60 years of age people, elderly people and above. So it remains predominantly informal and family centered. So when we look at it in Nigeria mainly, it is mainly informal because it's this care for these people if practically revolve around people within in a family or close members of the aged individual. So that is why we said it is predominantly informal and it is mostly family centered. You can only see maybe grandchildren taking care of their grandpa or grandma, or son or daughter of taking care of his father, of his vulnerable father, or uh, less privileged father taking care of him or her by himself. So it is mostly informal and family oriented and centered. So and it is relying on extended family networks and community support due to the absence of widespread formal geriatric service or residential care facilities. So when we are talking about social work service in Nigeria, it is very rare and lacking. So this is why most people encourage themselves to take care of their aged ones or aged persons by themselves because there is no they find it hard to or even government has not been able to provide. Apart from the government, they find it hard to enroll in a formal in a formal service or residential care facilities because it is very rare. It is very rare in the country. So the National Policy on Aging, approved in earlier years and under ongoing review as of 2025-2026, and it aims to produce healthy aging, income security and dignity, but implementation gaps persist. So implementation gaps persist in the sense that despite this the struggle, the strive to achieve this to promote this healthy aging, income security and the like, so that lives will be very easier and to live for for the aged individuals. But to implement this has been a bigger problem because it's including adequate geriatric units in hospitals and no comprehensive national program for routine assessments of physical, cognitive or psychosocial health in older adults. So we're moving on to the next subtopic now, which is care for sick persons and persons with disability. So to some appreciable extent, we've been able to justify the subtopic care for aged ones. So now what we'll be looking at here is care for sick persons and persons with disability. Those people that are disabled, how can we treat them? Who are mostly in charge of taking care of them? Who can reach take them of them? Who can take care of them effectively? Who can make them feel inclusive? So it simply means that care for sick persons and persons with disability in Nigeria simply involves a mix of it involves a mix of family based support, then limited public mix of family based support. It is unlike the age care for each person. So this one is mixed in the sense that we have family based support definitely, which is very essential and important. After family based support, we also have limited public health services and some non-governmental organization interventions. But also systemic barriers severely restrict access to adequate management and inclusion. So it is more of family based support, but with some little assistance and services from different public health sectors and NGO, or that's non-governmental organizations. So chronic illness management is challenged by high out of pocket costs, limited specialized care, and poor integration of services for conditions like diabetes, hypertension, or HIV related complications. So, with many individuals relying on informal caregivers who face burnout and lack training, you understand? Uh, the informal the informal caregiver and the like, they are just doing it out of love for being a family member. It is not like they have the adequate or proper training to do that, or to do that professionally. They are just trying. So the National Health Insurance Scheme covers only a small fraction of the population and subsidized for assistive devices or long-term care are insufficient, which exacerbating vulnerabilities in rural areas. So these people are people who happen to suffer from this um, lack of proper formal settings for uh, care for the persons with disabilities, are those in the rural areas mainly. So let's move on to the care for babies and infants now. We've discussed care for aged ones. We've discussed care for people with vulnerabilities and disabilities that cannot do things by themselves on their own. They need someone to help them, or to do this, or to achieve that, and also to feel socially inclusive. So now we'll be moving to care for babies and infants. How do we properly care for babies and infants? So it's in Nigeria, care for babies and infants, it primarily focuses on promoting early childhood development through family nurturing, community practices, and government supported programs emphasizing nutrition, health, stimulation, and responsive caregiving in critical first years of life. So early childhood development support is guided by the framework that is aligned with global standards, like the nurturing care framework, involving interventions such as exclusive breastfeeding. So in one way or the other, government has been able to, this is more this got more attention from the government and officials than the previous one that we've discussed, because talking of trying to how to raise a good child, how to give early childhood development and support and the likes. For instance, we have the exclusive breastfeeding, for as instance, that the government tried to pass across the information in different platforms, be it on radio, televisions, and newspaper. So early yeah. So such as exclusive breastfeeding, promotion, immunization, growth monitoring, and play-based learning. So in order to enhance cognitive, physical, social, and emotional growth, often delivered via primary healthcare centers, community health workers, and initiatives like school feeding or conditional cash transfers, that is under the National Social Investment Programs. So in conclusion, to conclude this module, we can see that social care for vulnerable people embodies a it embodies a vital moral and practical imperative to safeguard human dignity, and also not only that, but also to promote well-being and foster social inclusion amid growing challenges. Sorry, these growing challenges could come as in form of poverty, it could come as urbanization, it could come in form of conflict and demographic shift. So while also traditional family and community networks also continue to form the backbone of support for groups like the elderly, persons with disabilities, like the elderly people, persons with disabilities, the chronically ill, and infants, former system through initiatives like the National Social Investment